The COVID-19 pandemic is a public health emergency that has upended the economy, causing tens of thousands of New Mexicans to lose their jobs and the health insurance provided by their employer. No one should go without health coverage during this crisis. Here is Health Action New Mexico's guide to staying covered and avoiding scams if you lose your job-based insurance. There are quality coverage options available to all people in New Mexico. And if you've recently lost your insurance, we will be going over 3 options for getting covered. We'll start with Medicaid. Medicaid is a comprehensive health coverage program that is available to low-income U.S. citizens. Even if you're not usually eligible, you may be eligible now. If your income is too high for Medicaid, the New Mexico Health Exchange, called Be Well New Mexico, is the next place to check. The exchange offers quality coverage for purchase, and many New Mexicans qualify for discounts. If you don't qualify for those options, you automatically qualify for comprehensive coverage on the New Mexico Medical Insurance Pool. It is important to sign up as soon as possible to avoid disruptions in coverage and meet the deadline for getting covered. Remember, by the governor's order, COVID testing and treatment are free with all the forms of coverage in this video. Before we continue, make sure to have the necessary information for determining your eligibility. First, you need your household size, which includes you, your legal spouse, and any tax dependents. Second, you will need your income. Medicaid normally determines eligibility based on your previous month's income, but for now is calculated based on your current monthly income. If you experience job loss or another drop in income this month, you may qualify. The New Mexico Medical Insurance Pool also calculates based off of monthly income. However, if you don't qualify for those options, Be Well New Mexico calculates based off of annual income, so be ready to calculate that too. To determine your monthly income for Medicaid, include current job earnings from you and your spouse, if any, unemployment benefit amounts, not including the $600 extra being dispersed due to COVID-19, and any severance benefits you may have received this month. Do not include prior job earnings or earnings you expect in the future, SNAP benefits, or food stamps, or any tax rebates, including the federal stimulus check. Once you have your current monthly income, let's see if you qualify. Use this chart to match your household size to the maximum monthly income to qualify for Medicaid. If you are single with no dependents, your household size is 1, and your monthly income limit to receive Medicaid is $1,467. If you are pregnant, the limit is $2,712. For another example, if you are legally married and have one child who is tax dependent, your household size is 3, and your income limit is $2,498. If you're pregnant, the threshold is, again, higher. Feel free to pause this video and determine your monthly income limit based on this chart. If you feel that you may qualify for Medicaid, visit yes.state.nm.us to fill out an application. If you prefer, you may sign up over the phone by calling 1-855-637-6574 or print and mail the paper application by clicking the link on the screen. If you need help with your Medicaid application, call customer service at 1-800-283-4465 or visit the web page at the bottom right of the screen. If you don't qualify for Medicaid, check with Be Well New Mexico. Be Well is New Mexico's health insurance exchange, where you can buy quality health insurance from private carriers. Normally, you can only purchase this coverage during an open enrollment period one time a year, but major life events such as job loss may qualify you for a special enrollment period. If you lose your job, you have 60 days prior to the loss of your job and 60 days after to qualify for coverage. To see if you qualify for discounts, you'll need to estimate your annual income for this year. Include current earnings from your job and your spouse, if any, earnings from prior and expected future jobs this year, unemployment benefits not including the $600 COVID bonus, and any severance benefits you received this year. Do not include food stamps or tax rebates, including the stimulus check. Again, use this chart to match your household size to income limits for discounts on Be Well New Mexico. You may qualify for two types of discounts on the exchange. Premium discounts, which reduce the cost you pay every month for your plan, and cost-sharing reductions, which reduce out-of-pocket costs when you receive medical care. Feel free to pause the video, find your family size on the left, which again is your legal spouse and any tax dependents, and find your income limits in the ranges to the right. Once you have your estimated annual income and an idea of what you may qualify for, we recommend calling first to confirm your eligibility and sign up over the phone. Call 1-833-862-3935 to talk to an enrollment counselor at Be Well New Mexico. If you prefer, you can sign up online at www.healthcare.gov. Or you can print and mail a paper application through the link at the bottom right of the screen. If you don't qualify for Medicaid or exchange coverage, you automatically qualify for coverage on the New Mexico Medical Insurance Pool. You can sign up anytime and you may qualify for premium discounts. To see if you qualify for discounts, you'll need an estimated monthly household income. Please visit the Medicaid section for a detailed guide on how to determine your monthly income. In general, if you use this chart and find your family size on the left and find your monthly household income in the ranges on the right, you can see if you qualify for any discounts. If you don't, you can still qualify for coverage at full cost. Again, we strongly recommend calling first to confirm your eligibility and get help signing up. Call 1-855-637-6574 to connect with the pool. You can also fill out a digital or paper application at the link at the bottom of the screen. As a final option, if you worked for a large employer, meaning 20 employees or more, you can continue your employer-based coverage through COBRA. However, this is usually not the most affordable option. If you qualify for Medicaid, the exchange, or the pool, these are likely more affordable. But if you would like to see if you qualify for COBRA, check at the link on the screen. And remember, don't fall for scams. Beware of junk plans sold outside of these options by companies trying to profit off the pandemic. These plans won't cover you when you need it. You qualify for affordable, quality coverage through Medicaid, the Marketplace, or the New Mexico Medical Insurance Pool. If you need further assistance signing up for coverage, visit this page to connect to an enrollment counselor. BeWellNM.com/find-counselor. Be Well enrollment counselors can help you sign up for the right program, even if it's not with Be Well New Mexico. This information is brought to you by Health Action New Mexico, a nonprofit advocacy organization whose mission is helping secure access to health and dental care services for New Mexico residents. Thanks for watching, and feel free to reach out to Health Action with any questions.